OASIS intervention is a comprehensive organizational level intervention designed to improve antibiotic prescribing in participating skilled nursing facilities. This video is one part of a series designed to provide education about the OASIS intervention to nursing home staff. In this video, we will be going over why antibiotic use in skilled nursing facilities matters. This provides some background for why we're doing this intervention, and will also set the stage for how this intervention can improve the safety of residents living in your skilled nursing facility. So, antibiotics are one of the most commonly prescribed medications in skilled nursing facilities. We've done a number of studies in Wisconsin nursing homes, and other investigators have done a number of studies in other states showing a very similar pattern. We now know that up to 2/3 of residents who stay in a nursing home for at least 6 months will receive at least one course of antibiotics. We also know that many residents often receive antibiotics repeatedly. In one of our studies, we found that 20% of the nursing home residents were responsible for 60% of the antibiotic use in the facility. And when we followed residents for up to a year, we found that some individuals were receiving up to 14 courses of antibiotics in a single year. When we look at the appropriateness of these prescribing events, we find that a lot of the antibiotic prescribing is not justified. This again is data from Wisconsin nursing homes, which shows that less than 50% of the antibiotics prescribed in our study nursing homes were justified from the perspective of whether an antibiotic should have been started in the first place, regardless of whether you use the McGear or the Loeb criteria. However, even when an antibiotic course is justified, the choice of the antibiotic, as well as the duration of the antibiotic, is often inappropriate. For example, we see a lot of fluoroquinolone antibiotic use when a more narrow spectrum antibiotic such as Bactrim or nitrofurantoin would work just as well. Similarly, we find that residents are often receiving greater than 1 week and often greater than 2 weeks of antibiotic therapy for infections that can be treated with 7 days or less of antibiotic therapy. Now, this wouldn't be a problem if antibiotic use didn't have some harmful effects to residents. And when we look at the harmful effects of antibiotics, it's important to note that these effects exist at both the individual resident level, at the facility level, and at the community level. At the individual resident level, we know that antibiotics are one of the most common causes of adverse drug events. For example, 1 in 5 of all adverse drug events in skilled nursing facilities are as a result of antibiotic use. And when you look at the actual risk of adverse drug events when compared to antipsychotics, which is a drug that has garnered a lot of attention in nursing homes, we find that antibiotics carry a similar risk of adverse drug events. Obviously, antibiotic use also poses some risk of antibiotic resistance. We now know that resistant bacteria commonly emerge shortly after receiving a course of antibiotics. And we also know that this acquisition of resistance can persist for up to a year even without further antibiotic exposures. This makes treating subsequent infections much more difficult. And then finally, I think we're all familiar with this concept that Clostridium difficile is becoming a much bigger problem in nursing homes, and antibiotics are the most common risk factor for acquisition of C. difficile and development of C. difficile infection. There are a number of studies now showing that antibiotics increase a resident's risk of C. difficile by 8-fold, and more than half of all the C. difficile that we encounter in healthcare facilities now have their initiation in skilled nursing facilities. But even beyond the individual resident, it's important to know that there can be side effects to residents who are not receiving antibiotics. This is a very interesting study that was published from Canada, where they looked at 607 nursing homes in the Ontario region, and they separated those facilities into 3 groups: facilities that were low utilizers of antibiotics, medium users of antibiotics, and high users of antibiotics. And they followed the 110,000 residents in these facilities for up to 2 years and looked at what happened in the residents who never received an antibiotic. Now, the first thing to note here is that the vast majority of residents in these facilities did get at least 1 course of antibiotic, but a substantial minority, 27,000, never received an antibiotic during this 2-year study period. And what the investigators in this study were interested in looking at, well, what was the rate of C. difficile, diarrhea, and antibiotic resistance in that group of residents who never received an antibiotic. And when they looked at outcomes in those facilities, in those 3 groups of antibiotic utilization, low, medium, and high, what they found was that residents who were living in a high utilizing nursing home, even though they had never received an antibiotic, were 24% more likely to experience one of those bad outcomes relative to residents who were in a low-utilizing nursing home. So again, this speaks to the fact that giving antibiotics to residents not only has harms for that individual resident, but potentially has harms for residents in that same facility. This also exerts some problems from a facility risk perspective. As you are all familiar, there's increasing scrutiny on antibiotic use and medication safety in skilled nursing facilities. And one of the most common survey deficiencies cited for nursing homes is the F-tag 329, which is inappropriate medication use. In Wisconsin in particular, this F329 tag is being used frequently for inappropriate antibiotic use. And when we look over the last 3 years, anywhere from a third to a half of all F329 deficiencies are for inappropriate antibiotic use. We predict that this will become an increasing number, particularly in light of Medicare's upcoming conditions of participation policies, which will place a greater emphasis on wise use of antibiotics in skilled nursing facilities. Finally, antibiotic use has consequences outside of the nursing home. And we now know that nursing homes are important vehicles for the regional spread of antibiotic resistance, particularly to hospitals in the region. This is a figure on the left showing the influence of long-term care facilities on the spread of a particularly difficult form of resistant bacteria called carbapenemase-resistant Enterobacteriaceae, or CRE. And it's important to note that nursing homes in this study were a major factor in the spread of resistance, and hospitals were actually the recipients of resistance rather than being the engines of resistance, which is a little bit opposite of what one would expect. The facility in the middle, the red dot, is a long-term acute care hospital, and it was responsible for spreading the CRE to a number of hospitals, which are the blue triangles. But in the shaded area, you can see several green dots, which are actually nursing homes, and they were also actively involved in spreading CRE to a number of hospitals in the region. And the reason for this is somewhat intuitive. Nursing home residents are prescribed antibiotics quite frequently. They're often already colonized with resistant organisms or acquire resistant organisms, and these can be spread to other individuals. We also know that residents in nursing homes are frequently transferred back to hospitals, either the emergency room or for admission, and this results in ample opportunity for spread from facility to facility. And this has not been shown, this has now been shown with a number of resistant organisms, including MRSA, VRE, and other forms of resistant gram-negative bacteria. So in conclusion, we've discussed now the importance of antibiotic use in nursing homes. We will be talking in subsequent videos on how skilled nursing facilities can affect antibiotic use in a positive way, the components of the intervention that we will be implementing in your facility to achieve these aims, and we'll also give you examples of how these components are intended for use. Please see these other videos for more information.